Indidi, I'm running in your coat and do me down more feel it dizzy. Oh, papa, baby, you are say, baby, yes, I will cook nipa. You will cook you man Africans in the grass and baba. Share, soldier Suro Corona, lawyer Osuro Corona, Malam Suro Corona, while I will pass to you Suro Corona. Bayati to be a Suro Corona. Suro Corona, so who knows Max is a look of Mama, who refuse to meet a social distance and weapon. All one surface seminar, and sanitizer to Fabi Fair, Mantan Quick, the Nishia, not Sister didn't change my
Charlie, we have to look after ourselves and each other. This thing is deadly. It's deadly. And it's getting worse. Anyway, that's to come. We'll be figuring out what's happening in Kumasi and what's happening in people's trousers after they recover from coronavirus. Now, Charlie, erectile dysfunction at this time. Now, Vodafone cares about you so much. Your network cares about you so much. And look, I have physical proof of this. Winston, yesterday, I went home to experience brand new Vodafone Fiber installed by the amazing team at Vodafone. Everybody chipped in. Ken, who manages the team that does the installations, Daniel, and a bunch of people, including Patricia Obonai herself, all came together to help get connectivity to my place. And I'm so grateful because it means that I can actually go home a bit earlier and start working there now. Fantastic Vodafone Fiber. Thanks to our friends at Vodafone. Good morning to them.
Now that you say it means that you can get home early, I'll be checking to ensure that you indeed get home early.
Oh, right now I have motivation. Good morning to who? What's he got to do with this? I wonder. Anyway, yes, thanks to Patricia Obonai and her team, I will be getting home early now. All right, so it's amazing when your network cares about you so much that they do amazing things for you, right? And this time I'm talking about the Vodafone Cash dropping all charges when you send money to all networks. Yeah, you heard me. It costs nothing, absolutely nothing, when you send money via Vodafone Cash to all networks. So send any amount as many times as you want to any network and pay zero charges on the money sent. So go ahead, make payments, show your love, make contributions, send money, all you want via Vodafone Cash to all networks for free. Dial *110# to send cash for free. Ready? Now, look, carrying cash is so last season. The new thing is to pay with your card, whether you're making payments from a point-of-sale machine or online. Get the quick assist using your contactless Absa vertical card and get great discounts from their partners. It's contactless, okay? So that means you can pay with a tap on the point-of-sale machine, making it even safer this COVID-19 period. You get to enjoy up to 40% discounts when you pay with the card at an Absa partner. Get the card assist from Absa and get things done. That is Africanacity. That is Absa. Absa, the official banking partner of the Premier League. Visit absa.com.gh. Terms and conditions apply. Please follow all COVID-19 protocols this season. Okay, so the GRA has some information for us. They want to remind all VAT, NHIL, and Get Fund Levy registered businesses that VAT, NHIL, and Get Fund Levy and Communications Service Tax, that's CST, returns for December 2020 should be submitted on the VAT, NHIL, Get Fund Levy, and CST returns forms not later than Friday, the 29th of January. That's tomorrow. Which is the last working day of the month. So file your VAT, NHIL, Get Fund, Levy, and CST returns early and avoid payment of penalties. Now, for VAT, NHIL, and Get Fund Levy, the penalty is 500 Ghana cedis and a further penalty of 10 Ghana cedis per day. That the return is not submitted. For CST operators, late filing of returns attracts a pecuniary penalty of 2,000 Ghana cedis and a further penalty of 500 Ghana cedis for each day the return is not submitted. Remember to submit the December 2020 returns no later than Friday, the 29th of January 2021, which is the last working day of the month, and avoid paying penalties. Please get in contact with the GRA via email. It's info@gra.gov.gh, via WhatsApp on 055 299 0000, or use the toll-free number, which is 0800 900 102. That is a message from the Commissioner General of the GRA. And the website, of course, is gra.gov.gh. Hashtag our taxes, our future. Speaking of our future, the children are our future. And in the Ashanti region, at the biggest hospital in the region, Komfanoche Teaching Hospital, we are starting to receive very disturbing reports of several children who are, unfortunately, testing positive for COVID-19. Now, these are children on the wards in the hospital. Let's find out a little bit more about it in this report.
The Komfanoche Teaching Hospital is the only pediatric referral facility in the northern sector of the country. The hospital is overwhelmed by the number of COVID-19 cases involving children. At least 9 cases have been recorded in the last 10 days. Head of the Child Health Directorate, Professor Samson Entry, says the situation has put a strain on the hospital.
We are having a huge surge in COVID positive cases. The disease initially, children were said to be spared. We have 14 over last year. The COVID strain that we are having now is really also affecting children seriously, because in the first of 10 days, less than 2 weeks, we are getting 9 cases. We don't know where we're going to go, and we are already full.
Management says the hospital is overstretched and it is in dire need of space.
As it is now, we are not in the position even to bring new cases. I don't mean COVID. Anybody who is sick, you come here, we will just drag you in front, grabbing an ambulance that you came with. If there's something we need to do for you, we can do to stabilize you, then we send you back. Because our wards are full, we are exploring the possibility of getting treatment center for children. As far as I'm concerned, we are in talks with the medical director. He also had discussion with the regional health directorate to see if they can create space for children who are stable, COVID positive who are stable, so that we can move some of them there, so that we can get space.
Medical Director of the Komfanoche Teaching Hospital, Professor Bafo Kofi Poku, says out of 504 samples taken, 251, representing 49.8%, returned positive.
At the end of 26th day of January, we have tested 504 patients, out of which 251 are positive, 49.8%. Almost 50% of all patients who have come here and have been tested have been found to be positive.
Now, that's just a scary statistic. I mean, however you look at it, it's horrifying. Guys, let's talk about this, because, first of all, these are children. That's the first and most alarming aspect of this. We keep hearing about how children have these really strong immune systems and can, resist and, survive this thing. But an 11-month-old child has tested positive. And this is happening on the wards. So it's not like they are testing positive in the community in large numbers. And well, they probably are right now. But it's not as if they are, testing positive in communities. They probably are, but this is what is happening in the hospital, in the healthcare center, in the healthcare facility. And for me, this is the alarm bell that is going off. It will mean that healthcare professionals are at risk, because that's not a COVID ward, that's a pediatric ward. So they won't be walking up and down in head-to-toe PPE. They will be at risk. They'll probably also be testing positive in large numbers, if we were to check. Their parents are also at risk. I mean, everybody's at risk. That's a ward. That's an open ward. 9 positive cases. What are we doing wrong with our healthcare system? And how have we got to this point where, first of all, our treatment centers are full? There's no space for these children in the treatment centers. And now the infections are spreading to children, 11-month-old children.
It's actually 11 days.
11 days old.
Yes, 11 days.
My word.
This brings me to a conversation we had a few days ago where I was making the point that the thing about corona is that it's changing, it's mutating. We don't know what it's going to look like. We don't know what it's going to be like in a few days, who is going to be able to affect. Now, you said earlier on that children, so far have fed pretty well under the circumstances. We haven't had that many infections, but all of a sudden we're finding out that children are becoming susceptible to this condition or this variant, and we're not sure which one it is, of COVID-19. Of course, it's very scary that they're in hospital and they're getting it, so where are they getting it from? What's the kind of protocol that's being observed, on the ward, and like you said, it means that the healthcare professionals are probably getting it, their parents are going to get it and take it home, possibly infect the other children. So it's very, very worrying, I think. And also, any parent who is listening, the first place your mind will go to is the fact that if children are getting affected at this level, then our children in school are much more susceptible now as well. Because one of the things that we've used to console ourselves as parents is that so far children seem to have a certain resilience when it comes to COVID-19, so they haven't been affected as much. And even if they are, they're largely asymptomatic, so they're not showing up greatly in the numbers. But this is some indication that our children are susceptible to COVID-19, and then it raises the question, of should they be in school or should they be at home? Winston, what do you think?
Well, Winston, before you come in, if you don't mind, let's speak to Ohiming Tiria. He's the one who did that report that we just listened to. And Ohiming joins us on the phone right now. Ohiming, good morning.
Good morning, Kojo.
Right. Now, you've been following this story. I don't know what management is saying to you about whether or not they are able to actually control and implement the protocols on the general wards. Because if this is happening in the pediatric wards, it's likely to be happening in other wards too, is it not?
Yes, Kojo, at the Confanochi Teaching Hospital, the mention of a child health directorate, when you mention child health directorate, it means a combination of several wards. We have the pediatric emergency unit, oncology. They also have specialist consulting rooms, annex, 10 annex, B5, B4, C3, C5, PICU, that is pediatric intensive care unit, and then mother and baby unit. So all these wards come together to form the child health directorate at Confanochi Teaching Hospital. Yes, yesterday, Professor Samson Entry, who is the head of the child health directorate, says there are instances where they have had difficulty, in maintaining strict protocols at the wards. He made mention of the fact that there are instances where relatives of patients come to the facilities not wearing their face mask. Though they will be at the wards, they will not be wearing their face mask. And he was unhappy that there are instances where health professionals, including nurses, look on unconcerned. And he says it's an issue that they have been tackling at the facility, and they know that they will succeed in this regard. And there was also a talk of whether they will be able to maintain social distancing at the wards. And the managers, from the medical director to head of the child health directorate, says it will be very difficult to ensure social distancing at the wards. These are the words of officials of Confanochi Teaching Hospital, Peju.
Now, what has happened to the infected children? I mean, where are they being kept and treated, especially the 11-day-old baby?
For the patients, we're told then again by the head of the child health directorate that the hospital, as it stands now, don't have a treatment center for children with COVID-19. So what they have done on their own accord is to demarcate and allocate treatment, beds and facilities for COVID-19 with children involved in COVID-19. So the entire Confanoche Teaching Hospital, they have about 11 beds for pediatric COVID-19. So what they do is when the child comes in and they screen the person just at the entrance or at the triage, and they detect symptoms of the condition in that particular child, there's a place where the child can be sent to, depending on the age of the child. If it's a baby, and then at the MDU, there's one bed there that takes care of that need. And they also have pediatric high U. That one has 3 beds. And then pediatric emergency unit, they also have 7 beds. So, 11 beds for pediatric COVID-19 cases at the Confanoche Teaching Hospital. But there are instances where children are admitted at the wards without them showing signs and symptoms right at the screening level. And that is where the problem is. Over the week we've been, following up this story of allegations from some caregivers from the facility that people, especially children with COVID-19 cases, positives are also managed alongside other patients. It's an issue that managers responded saying that it doesn't happen that way, but they admit that there are instances where people come in without showing the signs and symptoms of COVID-19. But because COVID-19 virus takes about 4 and 14 days to incubate, normally you might not show a person or a positive or suspected case might not even show the signs and symptoms until the person is admitted on the ward. Even when they detect the symptoms, what they do is to keep these people or positive cases away from the normal wards. And these are the wards where they send them to. But as it stands now, the hospital says there's not even space for other cases. So assuming that you are brought to the Confanoche Teaching Hospital, in the words of Professor Samson Entry, the best they can do is to stabilize you, and if possible, probably they will attend to you in the ambulance that brought you, or get you a space in front of the hospital to attend to you. And when your condition stabilizes, they will send you back to where you come from. So this is the situation in Kumasi, especially at the Confanoche Teaching Hospital, because the officials of Confanoche says Kumasi or Ashanti region is not like Accra, where you have several health facilities you can rely on. But in Ashanti region, it's only Confanoche, and Confanoche is not only serving the people of Ashanti region, but serves as a referral center for patients all the way from northern region of East, Upper East, and Upper West region, and other parts of the northern sector of the country.
Right.
So that is a precarious situation at Confanoche Teaching Hospital as we speak now.
It sounds like the makings of a capacity crisis at Confanoche. Now, very briefly, we've got just about a minute more with you, Ohiming. Briefly, tell us about this rather disturbing statistic, where it appears that about 50%, 1 in every 2 tests that have been done up until the 26th of January, was positive.
Yes, according to the medical director of Confanoche Teaching Hospital, Professor Kofi Bafo Opoku, he says between last year and January 26th, the hospital has taken 504 samples, and out of the 504 samples, 251, representing 49.8%, returned a positive. And he gave the breakdown for last quarter from September. And according to him, in September, for instance, they took 117 samples. 12 returned a positive, representing 10% of the samples taken. In October, 137 samples were taken and 14 positives. November, they took 165 samples, 14 representing 8.4 returned positive. And in December alone, they took 183 samples, 26 returned positive at 14.2%. So he says that, yes, people should be aware. We should, especially the media, should lead the advocacy and tell Ghanaians, especially those in Ashanti region, that COVID-19 is real, and they must adhere to strictly to the COVID-19 protocols being outlined by the Ministry of Health. Now, the hospital has also introduced measures, and this includes, one, they are limiting the number of visitors who visit patients at the facility. What it means is that every patient will be allowed one visitor per day. And then there were also arrangements where people use the facility as a thoroughfare. And he says that henceforth, they are going to ensure that nobody use Confanoche as a thoroughfare because the virus could be hovering around the facility. So people should take note of this and see their own lives.
Ohiming, thank you so much for that update from Confanoche Teaching Hospital. Let's learn a bit more. We're joined on the phone by the General Secretary of the Ghana Medical Association, Dr. Justice Yankson. Kwame Sapon-Asiedu joins us as well from the United Kingdom. Gentlemen, good morning to you both.
Good morning,
Good morning. Good morning to Justice.
Sir, bro, good morning. We've been all over the place.
We are meeting too often these days. That's a worry.
Charlie, we had some very late night meetings last night, but it's all good. You are up, I'm up. So thanks be to God.
Yeah, I know that you guys have been working hard to keep us all safer.
Charlie, it's not easy.
But yes, it's clearly not easy. Look at what's happening at Confanoche. And I am particularly concerned by that statistic we just heard Ohiming describe. Okay, so in December, we had a 14% positivity rate for all the samples that they sent for testing. But in January, we've gone up to 50%. Well, 49.8%. There's nothing really in it. It's 50%. Half of all samples have tested positive. Dr. Yankson.
Kojo, listening to hearing, it brings home all the issues, the problems that we've been talking about. I mean, this statistics, it takes it that this is a small research, in quotes, and this is at a community level. People within Kumasi, Ashanti region, basically go to Confanoche, and a small sample size gives you 50% return in terms of positive results. It tells you that we have significant community spread. I agree that the sample size may not be too huge, but if you look at the trend, it also mirrors what is happening within the national space, where our figures were down, let's say, between September till now. You can see a progressive rise, but in January, the rise is very steep. So clearly, we have a big problem on our hands by way of the COVID infections in the country. The second bit has to do, listening to him, has to do with the difficulties that the health facilities are facing and the fact that clearly they are overstretched. You can see how, per the report, they are struggling to handle COVID patients, specifically when it comes to kids. You could see the problems in there as he described or gave us a vivid account of what is happening. And then issues relating to infection prevention control and the fact that hospital-acquired infections may also be going on, all as a result of the fact that we don't have enough facilities to manage COVID. So the problems are there. The society itself also doesn't seem to be listening to a large extent because it tells you that people come into the health facilities and they don't even have masks on. They are not masked up. Meanwhile, last year at some point, it was so clear that without a mask, you cannot even enter the hospital. You will be turned away. So clearly, we have a challenge on our hand, and we will need to take some very drastic measures now to help keep the situation. Where we are heading, it doesn't look good for us. That is the obvious truth. We need to act and act now, because on a daily basis, the problems keep compounding, the issues are being brought to the fore, And that is it. This is Kofanoche. It's the second biggest hospital in the country. And you see the problems there.
Yeah.
Technically speaking, the biggest hospital, Kolebu, is no different in terms of the problem.
It's scary.
Fast forward it to the regions that don't even have the facilities and the human resource to start with. That creates a huge problem, especially when it comes to the specialized units like the AGUs, the ICUs, where you need specialized professionals in terms of practice to take care of the situation. So the health system clearly is overstretched. And one thing that we all have to understand and we all need to do quickly is that we need to go back to the measures that were put in place at the various health facilities some months back, where the OPDs were technically speaking regulated in terms of numbers, where some chronic patients could not really come in as it is. We were managing them via, e-health, mechanisms, i.e. video conferencing, phone calls, stuff like that, telemedicine, that kind of thing, where community pharmacists were interacting with doctors to help ensure that some of these patients can get their refills. That will reduce the numbers coming in. Then at the ward, the general ward, we need to go back to that arrangement where we had enough spacing of beds. Because, like you described, there are situations, that is what actually happens a lot of times. Aside those who may come in with the obvious symptoms, and then the doctors will also pick the signs and do all the bits, the testing and what have you, and confirm. There are others who may come into the health facility with problems related to, say, maybe their diabetes or their hypertension or something. They are on the ward. After a couple more days, you realize that, look, the patient's condition maybe has changed, or you have a high index of suspicion that, no, you need to probably screen the patient for COVID. The testing sometimes comes with this problem, the delays and what have you. The patient ends up staying on the ward for a lot longer. Meanwhile, there are other patients around. Ultimately, the result comes and this patient returns a positive result. In the process, the health professionals themselves may have been contaminated because of the poor IPC measures in place, or even the lack of PPEs in some situations. The relatives of patients who come around in their numbers may end up picking some of these infections from the health facility itself, or the patients who are on the ward with this patient who has tested positive but has been on the ward for maybe 4 days, 1 week, depending on the circumstance. Then clearly you have outbreaks of the disease in the health facilities.
Yeah.
We are compelled sometimes to close down some of the wards to try and see how we disinfect the place. So it's a problem, and we need to go back to the basics once again and do all the right things that we did somewhere last year. Thankfully, we have some experience, so it should be easy for us this time to start all these measures.
Dr.
We
Youngson,
need to limit numbers going to the hospitals at this point.
Dr. Youngson, we're going to talk a bit more about the role that healthcare professionals, doctors in particular, can play in turning this around. But Kwame, what on earth is happening? Testing is down, cases are up. Okay, so hospitals are full. Everyone has lost someone. Is this the work of some new strain? Which strain, though? South African, UK, or our very own as yet unidentified homegrown monster?
Thanks, Kujo. And why do I say so? If you listen to a Himen's report, the answers to what's going on lies in the numbers. Justice was saying something that, the sample sizes are small. Rather, I'll disagree. If you look at what he was quoting, he quoted in September in the hundreds, October in the hundreds, November in the hundreds, December just over 150. And from there you see a trend. It went from under 10% to just about 10%, then to 12%, then to 14%, and now to 48%. What you are seeing is the classical reproductive number exponential growth. You go from 1, then you go to 3, then you go to 9, then you go to 27, then you go to 81, then you go to 243. I have been saying this from the beginning of this pandemic. You cannot ignore the reproductive number and think that you have things under control. So, what has been happening is that whilst our testing has been low, because we are testing specifically for those who fit the case definition, the community spread has been going on because we have not been testing there. As it's been going on in the community, because about 15%, the last, Ghana Health Service briefing, they said that they had seen slightly more in this latest uptake, which is about 30%. Because that 15 to 30% is increasing because the size of your infected population is going up. And I'll digress a bit. So, for example, if you have 100 community cases, 15 to 30% getting sick and coming to the hospital for you to identify is just 15 to 30 people. When it goes to 1,000, it becomes 150 to 300 people. When it goes to 10,000, it becomes 1,500 to 3,000 people. As that exponential growth is going on, you have still the fixed number of health facilities. Your number of beds remains the same. Your number of hospitals remain the same. Your number of health professionals remain the same. The amount of funding you're using to manage this remains the same. So what happens? Quality of care drops, like you were saying. And I'm not surprised at a lot of the things I was hearing. Quality of care drops because the number of patients to be seen by a health professional increases. So, for example, if one nurse is supposed to see 10 patients, now it goes to 20. The same exponent increases for the doctors. Then what happens is that the bed occupancy also per person starts decreasing. There are more patients than there are beds. So rather than having to social distance the beds, you are having to aggregate them, or you're having to treat them in porta cabins or in sheds like he was explaining. What does that mean? Mortality is going to go up, because that is not the quality of air you need for a disease like this. And whilst people start deteriorating, you are now looking at your intensive care, you are now looking at your ventilators, there are more people requiring them. I would want to end this point by saying that much as the children getting infected is a concern, the saving grace is this far, in this wave, and from all the data I've seen so far, the children, even with those with serious underlying conditions, I was looking at some data this morning for some research in the University of Southampton, even children with serious underlying conditions are not faring worse for wear when it comes to COVID. Why, nobody knows, but that's what the data is showing. The concern is, however, the fact that they are not able to isolate them, and more children are getting infected either before the results for the primary case comes in, or because they have nowhere else to take them once they've tested positive. The reason being, the more the number of children, even if it's 2% who would be worse for wear, that 2% in terms of actual numbers starts going up. So what I'm saying is, I'm not surprised. This is a matter of the numbers. It's strict statistics, and I've been saying this from day one. Now we're seeing it in real life, and now it's being reported. This virus, especially if it's a new strain, we don't know at this point, even the reproductive number becomes a problem. Because if you say the reproductive number, unchallenged is 3. That is if you do nothing about it.
Right.
If then the strain becomes 50 to 70% more infectious, that changes the reproductive number by the same index point. So it will go up by 1.5 to 1.7 times. That would make the contagion number higher. That would make the doubling rate higher. So, like Justice said, bottom line, back to basics. All these statistics only work if we don't protect ourselves. They only work if we are not wearing our masks. They only work if we are not social distancing. They only work if we are not washing our hands. Let's go back to basics. Let's get these things done. And all this mathematics would become just theory. For now, the mathematics is not theory. We're seeing the mathematics play ball against us. And for as long as it plays ball against us, we're going to be the coppers.
Look, I don't want to sound defeatist, and in fact, I don't feel defeated. But from what you're saying, is this thing not out of our hands already? Is it not out of control already? I mean, from December, 14% positivity. to January, 50%.
Kojo, I doubt it's out of our hands. You see, like I've always said, and when I've had private conversations with the likes of Justice and a lot of other people to try and get an understanding of what's going on, I've always said one thing: we cannot give up. If we do give up, we would come off worse. At this point, we are in the realm of personal preservation based on the data. All hands on deck. Private sector, public sector, politicians, government, individuals. Everyone has to be on deck. If all of us start complying with the protocols, and if the risk communication becomes poignant, on point, telling us exactly what to do, not muddying the waters and trying to use pseudoscience to explain things that are obvious, that you can see even from the Kumasi trajectory, that when we go into December, there was a sudden jump to 14%, and then there's a jump to 48%. You can see that as
49.8%.
what do you call it? Yes. As our activities that aggregate us increased, the infections increased commensurate. That's not rocket science. That's just epidemiological statistics. I'm sorry. And that is where the risk communication should come from. Because if we don't stop, ask yourself, the people coming to the hospital are sick. Like in health, they would say they fit the case definition, and that's why they are being tested. What of those who don't fit the case definition? What of the data that came out yesterday, which says the new strain doesn't even cause loss of smell and taste? It either starts at the point where you start getting respiratory distress. So we cannot continue playing Russian roulette. The more I read, the more I realize that it's not out of our hands, it's actually within our hands, and we need to do a lot more to get this under control.
So have we identified the new strain? Is it the South African one, the British one, or some other one?
Well, Kojo,
We don't know.
for now, there is nothing like we have identified the strain. What has happened is that we have picked up these strains in the country from people who had traveled into the country. We pick them up, we send them into our treatment centers for treatment. The next phase of the whole exercise is for us to confirm whether these new strains are in our community. And
we are yet to do that.
That is being done by our colleague scientists at the University of Ghana.
Right.
But because it's a community exercise we are doing, and we are looking at the bigger nation, we have the disease in all 16 regions. It takes a while to come up with the final figures and confirm that indeed we have the new strain here in our community, and whether it is strain A, B, or C, South African, Brazilian, or whatever you may call it. So that is the sort of work that is being done now, and we are all hoping that sooner than later we'll get the confirmation and then know the extent. But even beyond the strain, like Kwame was saying, the problems are here without. And probably I should say this, Kwame probably may have lost something in what I said. He was also rather confirming exactly what I was saying. Rather, it wasn't a disagreement. I just said that looking at that sample size, it shows us that we have a big problem. But then, some may say that this is a small sample size. If even you go by that kind of argument, it still doesn't hold because the picture also reflects or mirrors exactly what we are seeing at the national level,
right?
Where the curve has suddenly, there's been a steep rise, especially December into January. So clearly what we are picking there shows that we have a huge problem on our hands in the community as well. So basically we agree on the same thing.
Right. Thank you both.
I totally agree with you, Justice.
Okay.
That, I think I misspoke on that count.
That's all right. Now I think we're all on the same level. Let's come back after these messages to ask that all-important question about erectile dysfunction and other post-COVID symptoms. After these.
Imagine say water wake up at dawn. You know buff, you know chop. When it vanish for your area for 2 weeks, you not get one drop safe inside your tank.
Hey.
Hajia, our life was in dangerous. Only our neighbor gets water with water tank.
Water tank?
Yes. Water tank. Mamma mia, that water tank gets meter for checking water level. That water tank be fine past Kumasi Selendion. That water tank be tough like Ghana Army. That water tank, they carry water pepe, so say some no go left inside the supply tank. What a tank! That's my boss, Mr. Poncho go talk.
Beautiful, durable, with water level indicator and accurate volume of water. Water tank. What a tank! By Duraplast.
The maritime sector is important to the growth of the economy. At the Ghana Shippers Authority, our aim is to ensure that we provide the best of service and support to importers and exporters all across the country by organizing seminars on new policies, how to avoid demurrage, resolving complaints at entry borders, negotiating port charges, and promoting the transit trade. So whether you are importing or exporting, we are ready to assist you at no cost. Visit us at Ghana Shippers Houses, Ridge Accra, GPHA Towers, Tema, NCA Building behind Fort Gardens, Kumasi, Takrady Shippers Center, Takrady, and Yamusa Building, Gumbihini, Tamale. We also have complaints units at the Elubu, Paga, Aflao Borders, and the Kotoka International Airport, and Takotel, Takrady. Call us on 0302 666 915 or toll free on 0800 300 55 or visit our website www.shippers.org.gh. Ghana Shippers Authority, providing shipping solutions.
What would you do if you have the choice to do anything in life? Build your dream house, take very good care of your family, and plan for a comfortable retirement. Plan a befitting funeral for your loved ones when they depart. How would you live if you knew there was a friend waiting to support you on all of your life's choices?
You have such a friend in Glyco Life Insurance. Glyco Life has all the plans to meet your life's needs. Your child's education, your life savings, your mortgage, funerals, redundancy, and your retirement, and takes the burden off your shoulders. So go ahead and live life to the fullest today with Glyco Life Insurance plans. And remember that all our policies are hedged against inflation. Talk to Glyco Life on 0302 218 500 or 246 142. Also visit our website at www.glycolife.com or any of our branches nationwide for more information.
Glycolife, we cushion you for life.
Glyco, we cushion you for life.
Life is more fleeting than we could ever realize. So live and refuse to be let down. Why let life beat you up when it's all going to fade away anyway? Celebrate life. Celebrate your loved ones. Protect your family when the worst happens by signing up for Old Mutual Black and White Family Plan on WhatsApp. It's safe, it's easy, convenient, and absolutely paperless. Just say hi to Old Mutual on WhatsApp number 0242 426 455. To begin, sign up with as low as 18 Ghana cedis. Enjoy 10% cashback every 3 years with no premium payment after 15 years. Old Mutual, 175 years of doing great things.
As a pandemic.
Coronavirus, COVID-19, Befinda crowd. Oh, why ne fever never bow, abre, oh, do, and wash it, anti-sense, anti-taste, yo, and do me diddy. I war running in your coat, and do me jaumo, and feel dizzy. Oh, papa, baby, you are say, baby, it's a way
Look, let's not play with this. This is a national security issue. So long after you have survived the virus, tested negative, hoping to rebuild your life, you could find yourself with a limp noodle. Erectile dysfunction has been identified as one of the possible post-COVID effects. Dr. Youngson, what's going on?
Kojo, that is a reality. You know, COVID-19 as a disease, let me put it that way, is not too old. So you could hear all of us say that, oh, the disease is new and all that. So in the initial stages, at the outset, the general direction was that, this was more of a respiratory disease. So it affects your respiratory system. But as we moved on and then data was being gathered, research and all the bits was happening, we started getting a lot more information. And it soon became clear to us that it is not only a respiratory problem, but COVID-19 is a multi-organ disease. So it affects all organs in the body. All tissues of the body, one way or the other, have been impacted by COVID-19. Now, what we have seen clearly is that post your recovery, like you described, you're testing negative, you're being discharged from the hospital and what have you, there are residual problems or complications that these patients will have to grapple with, especially those who get moderate, severe critical illness. And then even those with mild conditions who have been treated at home and all that, they also can get these problems post their recovery. And the problems cut across all organs. You may not have all, but you could have a combination. It could be 2, 3 different systems or organs involved. It could be just one for you. But the long and short of it is that post-COVID problems are there. Let me just mention a few of the things we see, and then we'll zoom in on why ED or erectile dysfunction in particular. You can have situations where these people will keep having the problems, and sometimes they've been described as the long haulers. For 100 days, for 6 months, they still have problems. So fatigue, things like muscle weakness, difficulty breathing, difficulty sleeping, hair loss, loss of smell, taste, problems with, say, their mobility, issues around, let's say, mental health, depression, anxiety, some neurocognitive, disorders. So somebody, for example, like the sort of things you may see in somebody with, say, dementia, those ones are described as neurocognitive. So maybe loss of memory, stuff like that. Their affect is affected. Some are beginning to get seizures and what have you. It's all because of the problems that COVID has created. And a lot of it is as a result of what we call the hyperinflammation that occurs when COVID-19 is at play. And that results in all these residual issues.
So are there some people who are more susceptible to these post-COVID effects, like maybe older people or people with particular pre-existing conditions or people in a certain part of the world? Who is most likely to end up with, erectile dysfunction or any of the other post-COVID symptoms?
Well, the truth is that the research is still ongoing, but the figures show that generally, like I said, those who get severe critical illnesses, those with moderate disease, tend to have these things the more. But of course, even those with a milder form, they also get. What we have also seen is that those who have some general, let's say, disease burden, poor health, generally, may also come up with these things. But the long and short of it is that all these things we have described, the hyperinflammation and what have you, the blood clotting and all the bits, results in a situation where you have damage to the vessels. The middle organ is such that it is blood that is pumped into it for the erection to be sustained or for you to see that, yes, it has grown inside. It's a spongy tissue. So as and when it has to erect, blood is pushed in. Now, some of these blood vessels that go in there to supply, and then those within the organ themselves, the organ itself, are destroyed by the COVID disease through the hyperinflammation activities that we are talking about. So the linings are destroyed, some are blocked, some clots may also form. So once you have this damage to the vessel, then you can have this problem.
Can it be fixed? Can such damage be fixed?
Hello?
Sorry, I was just wondering, can such damage be repaired?
Well, you may have to see a urologist for assessment. So probably, if you give me a bit of time, we'll get to that bit in no time. Then the heart itself, that also has to pump the blood. The heart and the heart muscles and all that are also, destroyed by COVID. So you have cardiomyopathies, myocarditis, all kinds of things happening. So the blood that has to be pumped there sometimes also is a problem. So this, for example, that kind of problems with the cardiovascular or vascular system can result in this erectile dysfunction. Issues around mental health. It affects your mental health. When the brain is attacked and all that, you may end up with some emotional distress and all of it, anxiety, depression, all the things you can talk about. Not just the attack on the brain, but even the circumstances around COVID, the isolation, the loss of family, friends, all the bits that happen can lead you into a situation where you could get, say, depression or any of the mental health or psychological illnesses, and then you end up with some emotional distress, some low libido, and ultimately that poor mental health will also result in some poor sexual function. And that will result in a situation like the erectile dysfunction. The overall disease burden, poor health, medications that you are taking put together could also result in it. Then there's sometimes also damage to the testicular cells, the cells within the testis. That is where testosterone is produced. And generally speaking, that is what makes us men. Testosterone is what makes us men. So when the cells within the testis that are supposed to produce this hormone are also destroyed through the hyperinflammation that COVID brings about, then you have a situation where your testosterone levels are decreased, and then generally speaking, it could also affect your ability to sustain erections. But the most critical thing about this testicular cells being destroyed is that particular testis is where the sperm and all that are produced. So we are, even though it is too early at this point to conclude, the scientific thinking is that could also affect your fertility in itself.
On top of erectile dysfunction?
Yes, that could also. But like I said, it's early days yet because you need a bit of time to be able to say conclusively that patients who had their testes compromised in terms of their function, clearly we have demonstrated that over a certain period, they are unable to, say, give birth, assuming the function of the penis is even on. So it's a very serious matter we are talking about here. And the key thing is that we need to mask up. We need to social distance or physical distance, wash our hands and all. It's the prevention that is key. But by way of treatment, what you will do, like we are doing now, we are running post-COVID clinics, and these are supposed to take care of the post-COVID syndrome and all that bit. So if for some reason somebody has seen changes in the function or the ability to erect, it will be imperative and very important that you consult your doctor. They look at it, depending on the situation. Most likely you'll be referred to a urologist who will take a deeper look at everything and then prescribe some form of treatment to help alleviate your problems for you.
Kwame, is there any evidence out there that even those who may have had COVID and been asymptomatic could end up developing post-COVID effects like erectile dysfunction?
Yeah, there's a lot of evidence. In fact, Justice has done a lot of justice to the medical aspect of it. I'm going to look at the data aspect of it. And yes, the answer is there's a lot of statistics available that the post-COVID effects are not limited to those with, moderate or severe or critical disease who survive. The point is that for many of those who were mildly symptomatic or asymptomatic, they only find out, there's a study that's published in the Lancet and another research going on in the University of Southampton, where what happened was they were looking at people with what's called oligospermia, low sperm count. And in parallel, they were testing for COVID-19 antibodies. They found out that amongst men between the age of 25 and 45, majority of them who had oligospermia didn't even know they had got COVID, but they had antibodies.
Wow.
So like Justice said, this virus seems to have an affinity for soft tissue, and that's why it goes to the lungs, it targets the kidneys, it seems to be targeting aspects of the brain and causing psychiatric issues, and now we found out that it's targeting your testes. The point is, you cannot know at this point what this virus is going to do next. When I found out that the virus had mutated to the point whereby the classical sign, which is loss of taste and smell, it had evolved from it to evade capture, I said this virus is out to deceive. And for a virus that's out to deceive, the only thing is to get the basics right, to make sure that you don't get infected if you can, and for the health system to make sure that if you get infected, the infection is not as debilitating as possible. The only way the health system can do that is if the number of people going in are decreased. And the only way the number of people going in would be decreased would be if we decide to follow the protocols. So any which way you look at the data, it points to just one thing. We have our health in our own hands. If you're a man, like I put on Facebook the other day and people were laughing, you've got a choice to make. The choice cannot be that dire. You either play Russian roulette with your life, risk getting seriously ill or dying, or if you don't, risk total impotency, or if you're lucky and you don't get that, risk infertility. If you are a man listening to me speak, and these options are put on the table, and you think they are options that you are prepared to gamble with, then you are not a real man, you are an idiot. And that is how I would want to leave it. Because I don't know how else I can put it. The options are there, but people are not listening. And the more the data points to more severe things, the more we say, oh, this has become a national security problem. Yes, it has. It's always been a national security problem because the thing started by shutting down your country. It shut down your health system. It shut down your economy. It shut down your social life. Now it's shutting down your organs. So initially, it started shutting down everything around you to give you a warning. You didn't listen. Now it started shutting down things in you to give you a warning. You are not listening. Eventually, it will shut you down and you become a mortal statistic. We cannot be playing these sort of games.
Why is the effect so random? And I think this is how I'd like us to wrap up, okay? Just final 2 minutes from each of you. Why is it so random how it affects different people? What is it that determines which symptoms one person will get compared to the other? Is anybody studying this? Is there any data to kind of point us in a certain direction? Or is it all just...
It's a bit difficult to tell, but we know that certain things like, say, your viral load can impact so much in how bad your disease outcomes are. Because if you have a high viral load, you end up with very severe disease and all that. The chances that a lot of your organs may be compromised in the process is high. The general ability of individuals to withstand certain conditions, so i.e. your immunity and all that may come to play, your underlying health issues and all that. But for me, the key thing is that, yes, like you said, the selection is random in terms of the effect. And what that means is that each of us has equal chances of ending up with all these serious things we are talking about. It is not the preserve of just some selected few. No. And like we keep saying, we are learning new things about the disease on daily, weekly, monthly basis. Because, like Kwame just said, it's out there to deceive all of us. It's playing tricks, and we are beginning to see the real deal when it comes to COVID. And we think that probably we might not even be done yet in terms of what is there to be unearthed. So please, like Kwame says, let's not behave as people who are, in quote, idiots. Let's stick to the protocols. Let's take good care of ourselves. And as the adage goes, prevention is better than cure. Because we've now realized that even after cure, you may be faced with problems. And this is affecting, a lot of people. So we should begin to change our mindset about the disease and realize that, look, we are actually dealing with a monster.
Indeed. Kwame.
Well, Justice has nailed it. We don't know. It's a simple answer. But what I can say is that this is a virus, and viruses mutate, and their mutations make them change their behavior. If anyone remembers HIV, started, then we had HIV-1, then we had HIV-2, and then we had variants all over the place with HIV-1 mixing with HIV-2 and mixed infections and all that. That can happen with this virus. So there is even the probability that someone would have more than one strain infecting them at the same time. The bottom line is, yes, mixed infection. It happens every time. It happens with malaria. It happens with a lot of infectious diseases. Mixed infections are real. So the answer to it is that, as a result, you wouldn't know until the immunological data becomes clear, and a lot of epidemiological studies have been done as to who is reacting. There are issues out there about race, about age, about genetic makeup, about underlying conditions. We know all these. But all I would always say, I enjoy statistics, and I always look at the numbers, and I come to speak to the likes of you, Kojo. But I don't want anyone to become a statistic. The pain for me is how we have sat down for so many people to become a statistic in this uptick. That's the biggest pain for me. Yes, it's nice to look at it if you are someone like me who likes the numbers, enjoys the numbers, likes to regress them, likes to look at the trends. It's beautiful. But would I want to be part of the numbers I am regressing and looking at and talking about? No. It's not safe. So please, don't give me the pleasure of doing my job. I'd rather you don't give me the pleasure, and Kojo calls me and says, is there any data out there? And I go, Kojo, sorry, everyone is behaving properly. There's no data. Have a nice day. And we cut the conversation. The only way that's going to happen is if we comply with the protocols.
Gentlemen, I join you in praying for the day when we don't have to have these conversations. Until then, though, thank you very much for educating us. God bless you both.
Thank you, Kojo.
Thank you, Kojo.
Please, have you heard? Have you heard? This is what you are gambling with. Oh. This is the gamble you are making. You could end up not being a man if you can't produce testosterone. Hey, Winston.
Well, Kojo, I've been listening quietly, and like we say sometimes, you don't even know what to say. The fact that this disease has, different aspects to it. But of course, there's always a solution. A solution is adhering to the safety protocols, Kojo. Look, I don't want to say much this morning, but I know that a lot of men would agree that when they wake up every morning, one of the first things they check is the sustenance of their manhood. You understand? The sustainability of that is very important to them. And so if you can no longer have that as a result of COVID-19, and then what that tells you is that you should try everything possible to make sure that you do not contract COVID-19. Now, while it may be expensive to see a urologist and pay lots of money, it doesn't cost that much to buy a mask and to sanitize your hands and to practice social distancing. It costs 1 Ghana cedi to buy a mask. It will cost you less than 10 Ghana cedis to buy a hand sanitizer. So, a little one. So you can do that, and it costs nothing to socially distance from one another. Just bear that in mind.
It's not that difficult too. It's not like you are being asked to drive a car with your feet in order to stay safe. It's not like you are being asked to take a shower in hot crude oil in order to stay safe. It's not like you are being asked to stab yourself in the eye in order to stay safe. You are simply being asked to wear a mask. Put a small film of fabric over your own nose and mouth so that you don't die or cause others to die. Wear your freaking mask, please.
Soja Suro Corona, Lawyer Osuro Corona, Malam Suro Corona, Wala Wapaste Osuro Corona.
Listen, start off the year by stepping up with DSTV. Oh, they've got you covered, okay? All you have to do is from now until the 31st of March, upgrade your current DSTV package to the next one, and DSTV will bump you up to the one above it at no extra cost. That's it. Simple. So, for example, you have access. All you have to do is pay for family, and DSTV will give you compact at no extra cost. Follow our friends at DSTV with the hashtag DSTV Step Up for more, or call them on 0302 740 540. Good morning to everybody at DSTV and Multi Choice. Cecil Sunkwa Mills and the team.